Louisville, Missouri from my dining room. It is cold. Well, it's not freezing cold. It's more thunderstorms coming this evening, so it's going to be an interesting weather day, or has been. But boy, the wind chill is there. So I'm sitting here with a heater next to me. We're going to talk about diabesity. If you've never heard of that, watch. We'll get this done in 20-25 minutes. So we've been talking about insulin and insulin resistance. So we're going to keep talking about why insulin is a good thing, but a high insulin level that stays chronic can be difficult, especially if you're trying to lose weight. So insulin resistance plays a pretty critical role in increasing insulin levels, and insulin drives weight gain and obesity. Okay. So what we need to know is what causes insulin resistance. So we need to look at insulin itself, because insulin is the hormone that we're talking about. So does insulin cause insulin resistance? Okay. Well, there is such a thing as a tumor that's called an insulinoma, which secretes huge amounts of abnormal levels of insulin. And so in patients that have an insulinoma, they'll have a large increase in insulin and very little else wrong with them. So in those patients, would you expect that higher levels of insulin would lead to insulin resistance? Well, they did an article and looked at it. Patients with insulinoma show insulin resistance in the absence of arterial hypertension. So as levels of insulin in the body go up and up, the levels of insulin resistance go up and up. So it's a protective mechanism, because if you just had unlimited amounts of insulin, that would lead to extremely low blood sugars and coma and death and seizures, etc. So since we don't want to die, and we have a physiologic system called our body, the body protects itself and develops insulin resistance. So that's a good thing in that situation. You have an insulinoma that's putting huge amounts of insulin in your blood. Your body's going to figure out how to handle that. So the treatment for that is to remove the tumor that's causing the insulin elevation. And if you surgically remove an insulinoma, that reverses the insulin resistance. Okay? So the bottom line is high levels of insulin cause insulin resistance. And taking away high insulin levels reverses insulin resistance. Okay, so what happens if we try to give somebody insulin resistance? So this paper, called Production of Insulin Resistance by Hyperinsulinemia, high levels of insulin in the blood, in men, is from a Diabetologia, I can't say it, Diabetologia, Missouri lingo. They were given 40 units of insulin an hour intravenously in this study. One group was given higher and higher doses of insulin, the other was given saline, so they had a control group. Okay, the blood sugar was kept stable by infusions of glucose, and then the subjects were tested to see if insulin resistance had developed. So those that had gotten an insulin infusion showed a 15% lower ability to use glucose compared to those that did not receive insulin. So in other words, the insulin group developed 15% greater insulin resistance. So the point is, you can be made insulin resistant by giving you insulin. All you need to do is give somebody insulin and they will get insulin resistant. Okay? There's another study named Effect of Sustained Physiologic Hyperinsulinemia and Hyperglycemia, high blood sugar, on insulin secretion and insulin sensitivity in man, by the same journal that I can't pronounce. Okay, so the previous study used insulin levels that were higher than what are usually seen naturally. This is a study that used doses of insulin that are often seen in humans. Okay, So this group was given a 96-hour constant infusion of insulin. They were not obese, they were not pre-diabetic, nor were they diabetic. They were normal and healthy. And after 96 hours of insulin infusion, their insulin sensitivity dropped by 20 to 40%, meaning that their insulin resistance increased by 20 to 40%. So if you take healthy, lean human subjects and give them insulin, you can make them insulin resistant. And type 2 diabetes is all about insulin resistance. Okay, so you can head these people into a state toward metabolic syndrome and insulin resistance and type 2 diabetes within about 3 days. So high insulin levels in the blood causes insulin resistance. Okay? So you see that same pattern in type 2 diabetes. Okay? Here's a study called Intensive Conventional Insulin Therapy for Type 2 Diabetes. This one I can pronounce, Diabetes Cares, the journal. This is from 1993. And the implication behind the study was that controlling blood sugar is the most important part of diabetes. Remember that blood sugar is not measuring your total body sugar, it's measuring the sugar that's circulating in your blood. Your total body sugar hasn't changed. So you would think, like most people have for years, that controlling blood sugar, you will have better diabetes outcome and you will be healthier. You would be wrong, and you would continue to have the rotting from the inside problem of diabetes. Okay? So this study, they took type 2 diabetics and intensified their insulin treatment and tightly controlled their blood sugars. Okay, so they started on no insulin, and by 6 months they were on 100 units of insulin a day. Their blood sugars were well controlled. So what happened to insulin resistance in that group? The more insulin they took, the more insulin resistance they got. And since diabetes is a disease of insulin resistance, their diabetes was getting worse. It wasn't getting better. So higher levels of insulin caused insulin resistance. So we've talked about the fact that insulin causes weight gain and obesity. And so if that's true, you could expect that as we increase the dose of insulin from 0 to 100 units per day over 6 months, patients would gain weight. And of course, in this study, that's exactly what happened. Patients gained in that study an average of 19 pounds over 6 months. But at the same time, they reduced their caloric intake by 300 calories per day. That started at the beginning of the study. So if you believe that caloric reduction leads to weight loss, so reduction of calories and increased movement, the old way of treating weight gain, you would be wondering why, if you reduced caloric intake by 300 calories a day, why would these people gain almost 20 pounds? It's insulin. Okay? The major question in obesity and weight gain is what is driving insulin levels in your blood higher. If your insulin levels go up, so does your body weight. So reduction in calories doesn't matter. Increased exercise doesn't matter. So insulin drives weight gain. Okay, so what about weight gain in general? What drives insulin? So elevated insulin causes weight gain. So the carbohydrate insulin hypothesis assumes that carbohydrates drive insulin levels, but we examined that. That's not a complete theory. So insulin itself will drive insulin resistance, which increases insulin levels in the blood in a self-reinforcing vicious cycle. So the longer and higher the insulin levels, the higher the insulin resistance. And the higher the insulin resistance, the higher blood levels of insulin you're carrying at any given time. So that's the time-dependent effect of obesity. People that are heavy get heavier. The longer you have weight gain or obesity, the harder it is to eradicate because insulin causes obesity. So most current thinking about diabetes and obesity completely ignores the effects even though they're plainly obvious. Insulin causes weight gain. Insulin causes diabetes. It's an inescapable conclusion. So obesity and diabetes are driven by higher insulin levels. Okay? So the name for that is diabesity. So the new science of diabesity. So it's named that because of the close association between obesity and diabetes type 2. Okay, so obesity comes first, type 2 diabetes comes later, and not everybody that's type 2 diabetic is obese. So you can't always see um, the weight gain, like, fat around organs you can't necessarily see. Okay, so that leads many to conclude that obesity causes diabetes. And that seems reasonable since they often coexist, although not always. So explaining why and how obesity causes diabetes is the difficulty. So the answers become vague. Some people think that fat cells produce hormones that somehow cause diabetes. Some researchers suggest that fat cells produce a hormone called pigment epithelium derived factor that causes insulin resistance. But why would fat cells start producing a hormone like that in the first place? So some researchers think that fat cells produce a hormone called resistin, which causes insulin resistance. Others, this is from Harvard, think that obesity stresses out cells, which leads to insulin resistance and makes the cells send out a signal that insulin receptors should stop responding to insulin, and that causes insulin resistance. Okay, so the answer, however, is much more simple than that. So we've talked about the hormonal obesity theory, insulin being the main driver. Cortisol plays a role, maybe 10% of that, so stress does lead to weight gain and obesity. Okay, insulin increases insulin resistance in a vicious self-reinforcing cycle. Okay, so let's rearrange the hormone obesity theory. Both obesity and diabetes are caused by the same thing, high insulin levels. Okay, so they're tightly associated. And it also explains why all efforts to find how obesity causes diabetes have not been successful. Obesity does not cause type 2 diabetes. They are manifestations of hyperinsulinemia, elevated insulin levels in the blood. Okay, so it turns out that the entire metabolic syndrome relates to high insulin levels, and there's a common cause, insulin, high insulin levels. Okay, so they're essentially two sides of the same coin, or the same disease. So the term is diabesity. Okay, so insulin leads to insulin resistance, which leads to insulin in a vicious circle. So what comes first? Okay, so what if it's genetics, or is it people that have a high insulin level in general to start with? Obesity typically comes first, weight gain and obesity. So you kind of got to look at the time course of obesity, specifically people that become obese and heavy in their teenage years. So they did a paper on that. Early changes in postprandial insulin secretion, not in insulin sensitivity, characterizes juvenile obesity. They were able to measure insulin secretion in response to a standardized meal. Okay, so both groups in this study, both groups were heavy weighted or obese, and they had higher levels of insulin secretion compared to people that were not obese. Okay, so abnormally high insulin secretion develops early in the course of obesity and seems to stay that way. So what about insulin resistance? So you can see that insulin resistance develops over time. So a longer duration of obesity leads to insulin resistance increases. Okay, so the insulin resistance now contributes to more and more fasting insulin levels greater than 20. So and when you have a blood test for fasting insulin, you want to see that under 20. And people that are fasting, intermittent fasting, have levels that drop down to 5 and 4 and even 0 if they fast long enough. So insulin is the primary insult. Persistent high levels of insulin leads to insulin resistance, and then insulin resistance in turn leads to higher insulin levels. Okay. There was a report in the Journal of the American Medical Association that obesity rates, and this is fairly recent, for the age group 2 to 5, and who would think we would be talking about obesity rates in 2 to 5-year-olds, that they had dropped by 43%. Most of the other age groups, no change in the rate of obesity. And since childhood obesity is linked to adult obesity, that was a good news thing from JAMA. Okay. So the Move More people thought, oh, well, this is great. We've had an impact. So they believed that increased physical activity played a key role in the success for 2 to 5-year-olds, despite the fact that medical studies and physiologic studies, my cats are fighting with each other, mother-daughter, show that exercise has little or nothing to do with weight loss. Okay? So if that campaign of Move More was successful, why didn't you see any other age group that had a reduction in obesity? There's not too many people that think that their 2-year-olds need to be more active, or their 5-year-olds for that matter. So 2 to 5-year-olds are pretty active in general. Okay, and you don't see 2 to 5-year-old children in the gym doing aerobics, running the treadmill, pumping iron, doing leg lifts, etc. So adult obesity during that same time period has not changed. So it really depends on time dependency of obesity and elevated insulin levels. So those that have long-standing weight gain and obesity have more insulin resistance to overcome, and they have harder to treat obesity. I'm sorry, took my meds. I've got the cough. So a 2 to 5-year-old person has a short amount of obesity if in fact they're obese, so it's easier to treat those young children. Okay, let's look at sweeteners. 1977 to 2000, there was a steady increase in per capita sweetener consumption, and this was in response to the dietary guidelines from Senator McGovern that came out in 1977 with the infamous Food Pyramid Start, which was finally published in 1992. The goal was to eat lower and lower fats as a percentage of calories and increase your carbohydrate intake. So sugary foods, as long as they didn't have fat in them, was encouraged. And lo and behold, the obesity epidemic actually started in 1977, 1978. So sweetener consumption peaked in the year 2000, probably related to the Atkins diet. Even though the Atkins diet revolution started in the 1970s, it had a resurgence in the late 1990s and the early 2000s as the Atkins cuisine reigned supreme. So this included all the imitators of the Atkins diet, and you've watched them on commercials talking about low carbs. Okay, so all the attention paid to the low carb message resulted in lower sweetener intake due to the realization that sugar actually makes you gain weight. So you could have simply asked your mother or your grandmother, who would have told you that if you're gaining weight, you need to cut out the starches and get rid of sweet stuff. Quit eating desserts and sweets. But instead, we listen to politicians and doctors and nutritionists who said that sugar didn't make you fat. Fat was what made you fat. So eating fat. So the low-fat diet craze started, or the low-fat recommendations started with that panel in 1977 that I think met for about 3 months to decide, well, we're going to tell Americans how to eat, even though they've known how to eat for millennia. Okay? So as we ate more and more carbohydrates and lower fat, we gained more and more weight. So the key benefits of the Atkins message was that sugar intake started to fall starting in the year 2000. And even after the Atkins craze became unfashionable, the undeniable truth is that too much sugar is bad for you. It's really bad for you. In fact, it's like taking heroin. It's as addictive as heroin. So sugar intake falls in the year 2000 after a 5 to 10 year lag, and so does obesity in the most easy to treat group. So those that had not been heavy for a long period of time actually started to lose weight. So we're going to continue on the hormonal effects of obesity on Friday. This is Wednesday. I made it Monday and Wednesday. I taught at the high school yesterday. So I will see you Friday, and I'm still playing around with the Facebook algorithm as to what's the best time to go live. But this is up. It's on my page. It'll be on YouTube at Health Without Risk, usually within a couple of days. And I'll talk to you Friday. Have a great day. I'm going to try and stay warm. And I'm going to try and get rid of this cough from my Herbisart in mid. Okay, talk to you later. See ya. Bye.